Today I'm going to show you how to make a CPAP unit out of an ordinary ambubag, or even just a respiratory mask with some rubber bands, a glove, and some pressurized oxygen or air.
Background.
We've all seen CPAP save people from being intubated when oxygen alone wasn't enough. That's because normally gas exchange happens when the alveoli are open. If they're collapsed and inspiratory effort isn't enough to keep them open, efficient gas exchange can't occur. CPAP helps by supplementing the patient's effort. It stents open and recruits alveoli, and also pushes out edema like wringing out a damp sponge. This allows gas exchange to improve and the patient to get better. What if you're in a remote location where you don't have a dedicated CPAP device? Well, if you have an ambubag, you can make one. Remember, CPAP only works when the patient is trying to breathe.
Procedure.
The simplest way is to put a nasal cannula on the patient with the highest flow rate they can tolerate, and then attach a PEEP valve to an ambubag and hold the mask firmly on the patient with a good seal. You're trying to increase the pressure in this region. With every inspiration, the high flow oxygen supports the patient's effort with positive pressure. And with every exhalation, the PEEP valve will support end expiratory pressure. You can support with bagging if you want, but you don't have to. The only downside is that someone has to continuously hold pressure on the mask, which can be a hassle if there are other patients to treat. To get around this problem, cut the finger off a glove and cut a small hole in the tip, maybe the size of a drinking straw. Now, take several ordinary rubber bands and thread them together in a daisy chain like this. Make 2 daisy chains. Put the wide end of the glove finger over the mask aperture and secure it with a rubber band. Put the nasal cannula on the patient and connect it to pressurized oxygen or air. Now loop the 2 daisy chains over the mask aperture and around the patient's head like this. This will hold the mask on firmly. Turn the oxygen flow up high, well past 15. This will deliver inspiratory pressure, and the small hole in the rubber fingertip acts to provide end expiratory pressure as well. This way nobody has to apply continuous pressure to the mask. Yeah, okay, I know it looks like I'm going off to a German kink fetish party or something, but this really works and it can really save lives. If you're worried about high flow rates in the nasal cannula, just remember that it doesn't actually have to be in the patient's nostrils, just anywhere inside the mask to get the CPAP effect. One alternative is to cut off the end of the nasal cannula and just put the single air line inside the mask like this. A little tape might help, and you can see it works great and you can really dial up those flow rates.